Hi, Dr. Hagmeyer here again, and I'm so glad you made it to this side of the website. Now, if you're suffering with IBS, then the symptoms that go along with it, the gas, the bloating, the belching, the indigestion, the heartburn, the pain, the cramps, and the spasms, it's really just all too familiar in your daily struggles with the disease. The good news is that 90% of the time, IBS has its root causes in several key variables that can be addressed with dietary changes, as well as a very specific targeted nutritional support program. I'm going to assume that you're here because you're looking for an approach that goes above and beyond taking more medications, right? You're here because you're not looking for more of what hasn't worked in the past, okay? Now, there's really three things that you need to understand. If you can understand these three things, you're really going to understand really why my approach to working with people with digestive disorders and IBS is so successful. Now, let me first start by saying that I'm not here to sell you any specific supplement. I don't know what's wrong with you. I don't have any advice to give you as to what you should be taking, okay? But what I can tell you is that if you want to get healthy, you really need to understand these three things, okay? Number one is we have to look at the big picture. We have to go above and beyond just really trying to just treat symptoms, okay? And this is really all that conventional medicine really has to offer. Now, I realize that, IBS and just different digestive disorders can be very embarrassing. I realize that they can be frustrating. But what you need to really understand, and what really needs to be done, is that we need to identify many of these key players that are really at the actual root cause of why you're suffering in the first place, okay? So in other words, we need to kind of dig deeper into the metabolic imbalances that are existing within your body, okay? Number two is you really need to support the body rather than intrude upon it. And what that really means is that we really need to take a natural approach, okay? Simply dumping more medications into your body is really not going to be the answer. And so what I often tell people is that you cannot medicate yourself out of sickness or disease and into good, vibrant health, okay, with that kind of approach. It just doesn't happen. If you've been trying to do this, then you realize that that just doesn't work, and it's really only going to make you sicker in the long run, okay? And the third thing that you need to understand here is that each patient, and this is really probably the most important, each patient suffering with IBS is different, okay? So I'm going to say that again. Each patient with IBS is different, okay? We all have different lifestyles. We all have different nutritional requirements. We all have different daily stressors. We all have different biochemistry. And so understanding what makes you different and what your imbalances are and what's happening in your biochemistry is really the key to correcting your digestive disorder, your IBS, your celiac, or your Crohn's. Now, like I referenced earlier, the key to getting you well is really dependent upon identifying these unique stressors, okay? These are the 10 keys that once identified and corrected almost always assure success for you, the patient, okay? Now, the first key is a lack of beneficial bacteria throughout the gastrointestinal system. We all need to have these beneficial bacteria and a healthy terrain where the bacterial flora are in balance and can really flourish. Antibiotic use at any point in your lifetime has altered the optimal levels of these good bacteria. I want you to think about how many times in your life you've had ear infections, or how many times maybe you've had respiratory tract infections or urinary tract infections, or maybe even an abscessed tooth or having wisdom teeth pulled, or any other infection where you may have been on an antibiotic. And that includes even when you were a child, okay? So key number two is the possible presence of infectious bacteria, yeast, or parasites. With the right kinds of testing, and I'm going to tell you that the kinds of testing we use is what's called DNA typing. It's very sensitive. It's much more sensitive than probably what you've had done if you've had any kind of stool testing done. But through that kind of testing, we can really detect the presence of these hidden infections, okay? Now, these hidden infections really could have been picked up anywhere. They could have been picked on a vacation. They could have been picked up maybe when you were changing a baby's diaper. They could have been picked up from eating meat that wasn't cooked properly, poultry meat. And it could also be picked up even in raw fish, okay? So this could explain a lot of things. It could explain some of the bloating you're experiencing. It could explain some of the intestinal spasm. A lot of times people with digestive imbalances and hidden infections often have bad breath, or something referred to as halitosis. It could also be the cause of your diarrhea and obviously your constipation as well, okay? So key number three here is improper chemistry and pH of the GI environment. Now listen here. When you lose your optimal levels of good bacteria, in time the pH and the chemistry of your gut begins to change. And this means that things that normally wouldn't grow now start to grow. And now you end up with what's called small intestinal bacterial overgrowth. Very, very common problem for people that have IBS and suffer with digestive disorders, okay? Key number four is digestive enzymes, okay? aging or a very, very unhealthy gastrointestinal system may not be producing enough enzymes to digest your food. And if you don't digest your food because you're taking antacids or you're taking proton pump inhibitors, the food you eat is literally rotting and it's putrefying. And in other words, it literally becomes a cesspool for bacteria to grow and then take over. The other consequence of this is the fact that you can't break down foods. If you don't have proper digestive enzymes, if you don't have the proper environment of the GI system, what's going to happen is that the foods you eat aren't going to be able to be broken down. And so you're going to become deficient in all sorts of vitamins and minerals and nutrients. And just a classic example of that is if you went to your doctor and you've had any recent blood work testing done, hopefully they tested something called your vitamin D levels. Now I'm going to assume, because I look at blood work all day long, I'm going to assume that you're probably low in it. But I'm also going to say that this is not the only vitamin that you're low in. So here again, there are sophisticated tests that we can we can basically implement to help us detect what these intracellular nutritional deficiencies are. And this is where we see a lot of gas, we see a lot of bad breath, we see a lot of indigestion, we see a lot of skin conditions, we see a lot of allergies begin to develop, okay? Key number 5, key number 6, and key number 7 really all have to do with the foods you eat and the sensitivities that you may have towards them, okay? And what we're talking about here is that these could be the things like dairy intolerances, okay? Fructose or sugar sensitivities, soy, egg, gluten intolerance, and many even intolerances that are related to things called lectins. These are the things that are found in nightshade vegetables, beans, nuts, and seeds, okay? Now, key number 8 to restoring function and getting well is gut barrier functional testing. I want you to imagine this. I want you to imagine just the Great Wall of China being broken down by a neighboring country's soldiers. They have pickaxes and they're using sledgehammers to really kind of break through that barrier. Well, that's essentially what bacteria, what parasites, what molds, environmental toxins like plastics, and you've probably been hearing a lot about something called BPA lately, things like insecticides. That's what these things could be doing. They could be causing erosion of that barrier, breaking down of that barrier. And in turn, when that barrier begins to break down, this wall, as it begins to break down, now we start to develop and trigger autoimmune disorders, inflammatory responses, and also neurological conditions and problems. Things like depression, things like weight gain, things like brain fog, things like migraines, and obviously things like infections. Sinus infections could be a real common thing that we see often. Now, if that's happening, there are obviously some things that we can do to correct it. But the first step is really identifying it, and that's probably something that you haven't had done. Number 9 is food sensitivity testing. Okay, now you've heard that one man's food is another man's poison. Now, a big part of our program is really centered around restoring those lost nutrients and those vitamins and those minerals that are due to poor absorption. Okay, some of the foods that you're eating are really poison to your cells. In fact, your very next meal that you could be introducing poison to your system, and it won't affect you for another couple days. Let me give you an example. Have you ever eaten something one day where when you ate it, it was okay, but a week later you ate the same exact food for it to only cause things like diarrhea, more spasm and more cramping and more bloating? Food sensitivity testing, as well as just some of the other tests that I mentioned, can shed some light on this and will shed some light on this. And the final key is key number 10, which is hormonal imbalances. This is often overlooked, and really, if I was to describe hormones and the roles that they play, understand that hormones are chemical messengers, okay? And the health of your thyroid, your sex hormones, testosterone, estrogen, progesterone, and another type of hormone that's often overlooked is called your stress hormones, or hormones that are secreted by your adrenal glands. These are often overlooked. And so what happens is that these hormones have just a vital role and play just a tremendous impact on the healing of the gastrointestinal mucosa. These hormones can affect directly how foods are digested. They're going to affect how nutrients are extracted, how quick foods are converted into energy, and then again, how quick or slowly food is going to pass through the system, eventually leading to things like diarrhea or constipation. Hormones also play a role in how your body breaks down foods into its nutritional components. Okay, big part of what the thyroid does is involved in metabolism. Again, this is all accomplished through hormones, and this is why we look at hormones with all the patients that have digestive problems. People are often shocked to see and find out that they really actually have hormonal problems, but but they're also shocked to find out just the role that these hormones play on the GI tract. Now, with all this being said, this is really why my IBS and my GI restorative program works. Because it's based on testing, and it's based on these common denominators that we see over and over and over again that I just described in these 10 keys. This is your biochemistry, okay? And identifying where that problem is coming from, what parts of your biochemistry is dysfunctional, whatever key that may be. I know we just described 10, but you could have any number of those. And then identifying what those keys are, that's what our program is all about. That's how we are able to restore, rejuvenate, and really revitalize those glands and work with you implementing these dietary changes. Okay, so our program is really centered around dietary changes. It's centered around nutritional counseling. It's centered around very specific targeted supplements that are going to help you get your life back. So I always tell people that we never ever guess about which key we need to work on, because what we're going to do is we're going to identify what those keys are through the testing that we implement, and then that's going to help us develop a plan and tell us where we need to focus our attention, okay? Now, I have to ask you, doesn't that sound so much better than the typical advice that's being given to all of you for the years that you've been suffering? I hear day in and day out patients telling me, well, my doctor only told me to eat more fiber, or my doctor just told me that I was stressed out, that I just needed to go on a vacation. Or for a lot of people, I even hear, there's not really much else that can be done. Doesn't that approach that I just described make more sense? Doesn't that give you a sense of direction on really what needs to be done? Well, what makes our program so special and what makes it the most comprehensive program that I've ever seen is you take all those things that I just described and you combine that with doctors who actually care about you, doctors who are going to sit down with you and take the time to listen to you and then develop a program that's customized and individualized to you. That's what I call the recipe for success. That's what you're going to need if you want to get well. My advice here is stop wasting your money and your time on every supplement that you see and you hear about on the radio or that you read about on the internet with all these empty promises. Stop guessing about really what it's going to take in order for you to get well again. If what I just described makes sense to you, okay, and you're ready to invest in your health, you're ready to take your health in your own hands, we're going to show you how to do that, okay? Apply to our restorative program today. I only work with a limited number of patients. We get hundreds of requests on any given month. So if what I just described makes sense, here's what I want you to do. On the form, on this page, you're going to see a form, either to the side of me or below me. Take a few minutes, fill out that form. That's going to take you to another page where it's going to ask you a couple questions about your condition. I want to know a little bit about kind of, what your story is. I want to know a little bit about some of the things that you've tried, some of the things that hasn't worked for you. Answer those quick questions for me, and then once you submit that, you're going to get a call from one of my new patient care coordinators. They'll call you, they'll schedule you for a free phone consult with me, and it's really that easy, okay? So take a moment, fill out that form, and I hope this video was helpful to you, but more importantly, I hope it's something that causes you to take action, something that causes you to really be able to move from the state that you're in towards health and just good, vibrant health, okay? We'll see you then.